أستغفر الله أستغفر الله أستغفر الله الله.
The beautiful thing about the pancreas is that it is a classical exocrine gland. In fact, it could very often be confused with the parotid gland, except for the fact that it has these little white islands inside of it called the islets of Langerhans. Otherwise, on an average day, I could believe it was a salivary gland with 100% serous acini like the parotid. But let's go a little bit deeper and review exocrine in general. All these little blue areas separated by thin amounts of connective tissue are called lobules. Notice here's a big lobule, here's a somewhat smaller lobule, here's a real big lobule, and there's probably a very tiny lobule there. Notice also that, like in any exocrine gland or the other salivary glands we saw, you can have ducts that are within the acini, like here, and you can have ducts which are, ducts that are within the lobe, or ducts that are outside the lobe. So these would be called intralobular ducts, and there are several different kinds. And these can be called extralobular ducts or perhaps interlobular ducts. Doesn't matter what you call it. But ducts which are outside of the lobules are surrounded by connective tissue. Ducts that are inside the lobule are surrounded by acini. Notice we have a large vein here, a large vein here, a large vein here, a beautiful vein next to a beautiful artery, a beautiful artery here, and probably a vein here, an artery or a duct here, and a couple of veins here. I think this may very well be a duct because it looks like it has some epithelium, so let's prove it. No, it's an artery. Artery, vein, vein, maybe an artery there. Here's a vein, here's a duct, because the general ducts of the pancreas, which do only the carrying of the stuff and not the making of anything, are either cuboidal or columnar type cells arranged as a single cell. Here's a beautiful islet of Langerhans. Notice how it has no ducts or granules in it because it's strictly having the alpha cells, beta cells, so forth, secreting hormones into the blood, whereas in the exocrine portion of the pancreas we have zymogen granules secreted into the duct system. Let's take a closer look at a duct and some of the exocrine areas. The exocrine glands, the unit is an acinus. An acinus is a small group of 5, 6, 8, 10 cells in which you have a lot of granules in the inside, and the nuclei are erased towards a periphery. This is the typical acinus. These granules in the cytoplasm, like here, and all throughout here, and all throughout here, and all throughout here, and perhaps the majority of this cross-section, are zymogen granules secreted by acinar cells. Sometimes you have cells which look like fried eggs, like here, 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 and they have no granules. These are centroacinar cells, and they are the very beginning of the duct system. Notice within the lobule you may find an actual duct. Well, to tell you the truth, I think this might be an intralobular duct, but I'm a little concerned with the amount of connective tissue around it, so it could be kind of extralobular. We should have no trouble finding a nice, well-defined interlobular duct. Here is an islet, and don't bang your head against the wall. You really cannot differentiate on regular H&E microscopy alpha cells from beta cells. So just call these islet and just call these islet cells. And like many endocrine cells. They have abundant cytoplasm, nice round nuclei, but not as prominent granules as you see in the zymogen granules of the exocrine portion of the pancreas, like we have here. Let's find an intralobular duct. And to do that, let's back up rather than waste our time. I think we could probably, oh, look at that beautiful islet right there. Look how well defined that is. Look at all the acini around it with the zymogen granules and some centroacinar cells. And I think this critter here could probably qualify as a beautiful intralobular duct because it's entirely lined by epithelium. There's not any significant amount of connective tissue in it, and it's surrounded by acini. And you might also call this type of intralobular duct perhaps an intercalated duct as well, if you're a big stickler on using beautiful words. Otherwise, let's just call it intralobular. And let's call all the ducts that we see between the lobules as interlobular or extralobular. And notice also the pancreas has a good amount of fat in it as well. There's fat there, there's fat there. Notice the large artery here. And what do you think this guy is? I bet you it's a nerve. Let's blow it up and prove it. Yeah, it's definitely a beautiful little nerve, isn't it? And there's a tiny nerve, and there's a tiny nerve, and there's a small artery, and there's a small artery, and there's a nice little vein. And here's fat, and here are some more veins, and here are some lobules. And continuing or true to our shotgun approach, I will now ask you, is there anything on this entire slide you couldn't feel 100% confident in identifying? I bet your answer to that question is, Dr. Minarsik, no, I can identify everything. So please let's move on to the next damn slide. Thank you very much.
هاتنا واللي كفا ولنعاود من قريب ولنعد للنور صفا عهد ماضينا الأريب يا عسى الرحمن يهدي كل صبار منيب ويعيد الحب يندي بالهدى قلب الحبيب يا عسى الرحمن يهدي كل صبار منيب